today we have organised a health and wellbeing event for our patients that have had a cancer diagnosis. The theme of today has been moving forward, living well, life after cancer.
A great opportunity to reach out to people with many different types of cancers, but also their carers and their loved ones as well.
I think when you diagnose a cancer, your world changes. And cancer doesn't just touch a patient, it touches the whole family, all the loved ones, friends.
Well, I thought I've expected it because I'd been bleeding for 6 months. So I was really expecting the bad news. The cameraman said it was really 90%, he could tell it was cancerous.
Time was a shock to me. I felt that almost every part of me was gone. So I found that quite weird and quite disappointing because I never expected that I'll get another cancer.
Well, I think it's so important just to make sure that people with cancer and their families do know about the resources that are in the community and in and about their own hospital.
Days like today are tremendously valuable to people. It helps people come together with other people who've gone through similar experiences, to gain support, to recognise they're not alone in dealing with these things.
I think this helps patient awareness, and also that they are not alone in this part. There are people around them who are having maybe they experience same kind of problems.
Today's been fantastic. It's been really lovely meeting everyone. It's been really nice talking to the patients and the journey that they're on, and also the support groups that are out there for them.
I set the group up 6 years ago through my own personal cancer problems or journey, I should call it. But I couldn't find face-to-face, groups around the area. So I decided to set it up.
We're funding some posts at the Trust, and we're also putting in significant funds into the build of the new Macmillan Cancer Support Centre.
They've got somewhere to go that's non-medical, so it's non-clinical. So it could be that they've travelled a long way to get to their appointment, or even if they haven't travelled a long way, it's still a journey when they're going through something quite difficult. It's a place where if you've got family with you, rather than sitting in a hallway where they're going for your treatment, they can go there and sit somewhere nice and have a cup of tea, and just even if they just want to be by themselves, they can be.
Been enjoying it here today. I've learned a lot about the eating side, which is good.
Fantastic to have the expert speakers from the Trust today. All the feedback I've seen from the attendees has been really positive.
Days like this are really important to help patients, to empower them to understand what they can do and take control of, because they don't have control over the medical side of it, but they do have control over the lifestyle side of it. And exercise has been shown to really benefit patient outcomes or cancer outcomes. And I think having the knowledge for them to then take this forward is really important.
The community an opportunity to ask questions of healthcare professionals, and it's important that we can give good messages about food and eating for long-term well-being and health.
I know the importance of health and well-being, and I did trust that when I come here I'll learn something very important.
And that it's okay to struggle a little bit with that, that it's often it takes a while to come to terms with what you've gone through and to start to pick up the pieces of life, and to be kind to yourself when you're trying to think about moving on and do things one little bit at a time.
The care doesn't just end at the end of your treatment. We're still here for you because we care.
So I think it's really important for our patients that when they do complete their cancer treatments, that they know that we are there for them to support them with the ongoing symptoms, side effects that they might have experienced from their cancer treatments, and that we are there to support them on to living with and beyond cancer, and to celebrate that survivorship with them.